Hi, good afternoon, everyone. My name is Keisha Rawlins, and I am a nurse, and I'm also a caregiver. I'm so happy to be sitting in this chair this afternoon, and this topic today, it's a big topic, it's wide, it's passionate to me. It's the care of the elderly or senior citizens, and some of the things we're going to touch on today are what does care of the elderly really means? Why does elderly care, why is it so important? What role does the family play? What role does the community play? The role of the government in all this? Why we choose, or why do you or I choose to work with the elderly? The psychosocial needs, we'll touch on those. The nutritional needs, safety and security needs, skin integrity, elder abuse, elder neglect, and the way forward. Welcome everyone. What does care of the elderly mean? Well, it means different things to different people. For me personally, it means being involved in individual personalized care. And personalized means that even if you have 5 diabetics, they all are different. Maybe they are different because of their sex, their race. They may have other problems with the diabetes, so we can't put them all in a bracket and say, oh, those are the diabetics, and those are the ones that we label. We don't label here. With care of the elderly, we know they are diabetics, but each one, male or female, might have something wrong, and we have to address this situation personally. So we do a care plan. The plan of care is something that we personalize for the person individually, taking into consideration all their needs, whether it's psychosocial needs, the other health issues, what's happening in the home, what's happening when they go to the hospital, what happens when they go to the doctor for a visit. It's everything. It's a holistic approach to everything. So caring for them, for me, means that you have to get to know each client, patient, or loved one. Why I say loved one? Because sometimes care of the elderly involves people who are actually in the home. It's not always facility care or hospital care or a hospice. It's care that is given to any individual. It doesn't matter where they are. And the role, we'll look at that later, but the role for me should be a personal one. You're getting to know what's happening with this person in their mind, because mental health is this month as well. We want to know psychologically what's going on with this person, and then we come outside, that's internally, and we come outside and look at all the other factors that plays a role with this individual. So for me personally, care of the elderly is getting to know the elderly person or senior citizen on a personal basis, yet professional at the same time. The only how you can know how to build a house is to have a blueprint. So it's like having a blueprint for the person. And why is elderly care so important? Again, it's a personalized thing, and the approach is a personalized experience. It's important for me personally, and many others like myself who are involved with the elderly. And when we say elderly, these persons internationally, it's from age 65 and older. I personally think it should start even at 50, because we are aging. And there are other terms beside elderly, senior citizens, older adults, as the international realm looks at it. So we don't even want to label people as elderly anymore. It's an interchangeably phase. So it's elderly, senior citizens, older persons. For me personally, again, I think as you're passing 50, most people would be in their menopause stages, the females. I think at this stage, you're starting to get there. You're half of the century already. So for me, and today, we'll say anything past 50. So why is it so important? I have to go personal each time, because I don't want to quote from what is being taught, what is being told, what is being addressed. I want to do it from a personal perspective and professional perspective at the same time. Because why is it depends on the person who is doing the caring. We know people need help, whether it's old, young, black, white. We know everybody needs some care at some point in their life. The journey might not be so smooth for everyone. So the why really is dependent upon who you are as an individual. The way I see something might not necessarily mean that you see it the same way. So for the why, for me, is basically who you are as a person. If you care generally about the welfare of others, I think personally, no matter whether it's elderly or otherwise, you tend to want to put that in perspective, but some of us don't know how. So later on, we'll discuss how we can put how we feel about others and the genuine care we have, put it to work for the senior citizens in the Federation of St. Kitts. So the why is who you are really as a person, how you see life and how you see people. First, you have to be a people person to answer a question like that. If you're not, then you need to address it first, because the why is so much important. People do things, but they don't know why. And I personally do it. I care for the elderly, the senior citizens, the older persons, anybody within or around me, or even who I don't know, strangers, because I personally care about the welfare of others. I think caring brings a totality to how things are done. If you don't do things the right way, or you don't do things the respectful way or the moral way, then the why becomes a question mark. How can you say you're doing this and you don't care? How can you say you're a nurse and you don't have any empathy? So there you go. The role of why, or the reason for why we care for the elderly, is dependent personally to me upon who you are as a person. And the why also involves the aging process. This process is simple. It might be complex in its entirety, but simple in this format, as in we are all here today, we are aging. For some it might be a joy, a birthday is coming. For some a birthday has just passed. For some they have realized they're in their menopausal state and they're having all those symptoms that they don't particularly like. But personally, the aging process is happening every day, be it male or female. We are aging to the point where sometimes we look older than we really are. Thank God for makeup for some, because it helps, but some it doesn't really do anything. In fact, it makes it worse. So the role of the aging process is such that each day that passes, we are a day older. It might not be in its entirety for us, we don't see it. Many of us don't actually feel it, but it's actually happening. And this aging process is a normal phenomenon. It's not anything that is made up. It's not anything that we can do about it. We can help the situation as it goes on, but as long as time is evolving and the world is going on, it will naturally take its course. And all of this is to do with why is it important to care for the elderly? Why do we do it? So this aging process affects everyone, no matter the age. And that's why I said, for me personally, the aging process, the elderly care should really start from age 50 and up, because we're half of the century already. So the aging process is something that each of us need to consider, because it has ailments and problems and situations that arise, and it's nothing we can really do to stop them. We can minimize, we can delay, but we cannot stop the aging process. I cannot determine if my hair is going to be gray next week versus next year. I have nothing to do with that. It's a natural phenomenon. I cannot decide that my left leg, which is killing me right now, would hurt maybe next week and it won't hurt again, because I'm aging too. So I know the ailments I have, they are, some of them outside of any medical condition, are naturally occurring. So once we get that in our heads today, please, the why we care is because we are aging. All of us in this room today and in TV land, we are aging. So because of that, we know it's expected then. Let me put it that way. It's an expectation that will be a reality. What role does the family really play in all of this? Well, that's interesting because some family members don't know they are actually in the role of a caregiver. They don't know. And at first I said I'm a nurse and a caregiver. I deliberately said the two because I could have just said a nurse. But now we know, and we have many people know it before, nursing is nursing and caregiving is really caregiving. Why? Because we cannot put the two together in every instance. Why? Because people are caregivers, excellent at it, in fact, and they are not nurses. And in fact, they bring a whole love for this new thing that is happening that people don't realize is a big deal. And some nurses don't have that. They just don't. So I deliberately said I'm a nurse and a caregiver because I am both. And depending on where I am, I can be a nurse. And most of my other time, free time, or other time that I have outside of being a nurse, I am a caregiver at heart. So I separated the two deliberately because a nurse can sometimes just be a nurse, and a caregiver is another person who cares without having that degree. So the family plays a role, and sometimes they don't know. So sometimes it's our job to let them know once you have an ailing person at home or aging person at home, because the aging process is ever present. The person might not have any medical conditions, but they are aging. So therefore, automatically you're in the home with them, you're a caregiver. Whether you're a good one or not depends. But, and I said back to the first reason, who does this? Who cares? People who really care, they have an aspect to their lives that people will notice. So you could be in the home and you're a caregiver, but not necessarily meaning you're the best thing going around. You could be doing more harm than even good. But because you're placed in the situation, you're in the house with this person, you're naturally a caregiver. I'm someone who cares in the home, so I refer to the home because a facility caregiver is a facility caregiver, be it the hospital or the institution where elderly people live, or hospice, that's where people go to die. The role of the caregiver in the home is a family thing. If you're the family member, you could be the neighbor and the caregiver as well, because we have some neighbors behave like their family. You see them more than the actual family. So, or a distant cousin, it could be someone who is not even living in the home but cares for this person in whatever aspect, whether it's financially, emotionally, you know, even that person who just calls to say hi. So we all have a role in the family setting, but some people just don't know they are a caregiver. Now, a professional caregiver now is a different thing. That's somebody who had training with the elderly, so they know what to do, what they shouldn't. So it's a bit different, but all in all, we are all caregivers. So the role of the family is such a big one that I don't think people realize that we affect how things are done. Sometimes the professional comes into the home and we initiate certain things, and the family do the opposite when you're not there, even though you show them and educate them on what is to be expected outside of you being there. So that's why I say even a caregiver can be not such a good caregiver, because they're there, they're feeding the person, they're providing, but they're not talking to them, they're not listening, they're not, you know, they even will pinch and give them the sugar, and you know they're not supposed to have it. Even though you have a little cheat day now and then, they'll do the opposite to you as a professional person in the home. So the family needs to know that they are caregivers, and if you need to know any more about it, you can reach out to us at Care Nursing Agency, because sometimes people just need guidance. So you don't have to be a professional at anything to be good at it. You just need a little guidance on the know-hows, and then you'll get there. And this know-how and guidance is not going to be a one-time deal. It's not going to be, oh, this is a list of things you should do. It comes with experience, actually, and doing it over and over again, repeatedly. So what about the role of the community? Well, for me, community is a big deal, but we have a lot of labels, we have a lot of stigma, like the area we're in, Matt Night, we have stigma. We have a lot of people who feel like, you know, I don't want to go because you know, they're better than me, or even if they feel it in a good way, like, okay, the person might be thinking they're better than them, or they think it internally, I don't want to go because I think I'm too good for that. Whatever the reason is, the community is the people who we supposed to be dependent on and trust. Back in the day, I remember you could have come and finished the pot for the neighbor. You could have checked on the neighbor and be the babysitter. Now people are not so trusting anymore for reasons that are valid. People are scared because of all the killings in the past and the robberies and the things that happens in communities. And I will have to use McKnight because I live here and I'm in McKnight now. We are here now, present here in McKnight. And we have had a lot of issues that are not so nice at all. And because of that, we have a stigma attached to us, but we are trying to break away from that. Because even though it actually happened, we know it happened, and we are now adjusting ourselves and learning how to, you know, look on the bright side, because there is a bright side to everything. And the community, their role as caregivers should be back how it used to be. Actually, a lot of things are going back how it used to be, and I think it's a good thing. It depends, yes, but because we don't want to go backwards too much, because we know technology is something that we should embrace. It has its good. But going back doesn't mean we are going backwards. It means that we are looking at where we were to where we came from, and we realize we need to get back to the neighbor finishing the pot. Because we have 3 and 4 and 5 jobs now. The children are left alone. So it breaks down the whole family unit. And because we don't have that kind of community love anymore, and atmosphere that people could trust people now, even in their homes they feel scared to let the neighbor pass in. So a lot of the people in the area, we have a lot of shut-ins, you know, and nobody know they shut in because you're locking them in. Yes, that happens. You lock them in and you go to work and you put whoever there by them. We had an example of that when we did the tour. She was not locked in, but she was inside, nobody there. I don't even know if the community knows she in there by herself. So it means that the community has lost the love. Maybe not in totality, but definitely it's happening. And you won't know if you don't go to know. You won't know if you don't ask. And I have seen it firsthand as well. I always go back to, this is just my perspective, personally and professionally as well. We are moving away very rapidly from the community efforts, and we want to reignite that. I would like to reignite that in the community of McKnight. We want people to check in, have a buddy system where you check in on people. So those of you who are hearing me in TV land, those of you who are here, we probably would know 2 or 3 older persons. Let's use that term, older, because remember, they're not necessarily elderly. We could just check on them. Maybe if they don't have a phone, go and see them, because even calling might be good if you're very, very busy. But checking is to go and peep and see what's happening, because sometimes you go and peep, they need that little glass of water. The role of the community could be a good thing, and it could be a bad in the sense that sometimes the community mango season out, they carry a bucket of mango. That's diabetes in the bucket right there, and then the elderly don't have diabetes, so that's, I don't know where you put that on that, if what you're gonna get, but probably death. So we so nice sometimes, we too nice, we carry things what ain't supposed to be eaten, because there's no communication between the community and the persons who live there. So then when you carry this bucket of mango, you think you're doing good, you know, at the end of the day it's no good. Because the person, you never did know they is diabetic, you never knew they were hypertensive, you never knew nothing, because nobody asks you nothing, everybody just doing as they like. And then at the end of the day we're causing more harm. So the person who lives in the home don't know that the sugar went high, because the person next door brings 6 mango, grafted big mango, and because mango season you feel like you have to eat all one time, like somebody in here right now, they'll eat 20 mango if you leave them. Yes, you know who you are. But then the diabetic person ain't gonna say no. They're happy to, first of all, they're happy to see you, so they ain't even thinking about the 6 mango gonna carry up the sugar and they're gonna go in a coma, because nobody tell them that the 6 mango gonna give them any gonna make it bad. They walk out is a fruit, and they don't know that 6 mangoes really you should have half or even a small one, and they don't know nothing about sugar and how the sugar go, and they just know they're living their life, and they're glad to see somebody come talk. And while you're talking, you're eating the 6 mango, and when they're gone, you leave the persons who live there, who visits or who looks after this person in problems. because the community trying, yes, but because there's no real communication, nobody knows you shouldn't do this or you shouldn't do that, giving them things what they should eat, doubling up on the medication. They say, you had a thing, we take 2 more. It happens. They mean well, but if we all do it together, then they will know they're not to do that, but we don't communicate. So the community has a lot of work actually, and we want to reignite that love and support because it goes a long way. It actually would help the children who is in that environment as well. So sometimes actually caring for the older persons would educate the persons who live there to do better, and the children would follow because of course they're leading by examples. So the community has a big responsibility. The role of the government in all of this. Well, for me, I said it in a thank you some time ago, that the government's role should not be, we should not wait for the government to decide that we need this, and we know what we need. And for us to wait on anyone actually to decide that we need this for mommy, you know, mommy gonna slide when she go in the bath, but she ain't a bed person, she want to have a shower. Then buy a bed, the little nice bed chair, but you didn't know about it. But let's say you know about it. You're waiting for the government to sponsor you one or give you one. So she must fall every time she slip, or every time she don't hold on too good. She must fall because you're waiting on the government. Why are we waiting on the government at all? They have their responsibilities and roles. I'm not excusing any behavior that they should be addressing. But at the same time, you cannot depend on people to assist your family members. Because we are becoming a dependent set of people in the Federation, we want handouts for everything. We want everybody to give us everything free. Everything can't be free, and the government knows that. And basically, healthcare in St. Kitts is free. Most of the ships stop here because all the West Caribbean countries will tell you they cannot accept you. But we accept everyone that comes to our doors down there, and then we bring them to JNF. Yes, we do. Sometimes they can't even afford the bill, and the billing a lot is easy, and they can't, but then they get help and they leave. And we are getting free services from the health centers. We are getting free services even at JNF. When you're over a certain age, you don't pay for any medication. Where in the world you get that? Nowhere, hardly. Because everybody are looking for you to have insurance. And elderly persons, they don't have any insurance. So who pays for all of this? I don't think sometimes we realize who pays for it. We help pay for it, our taxes, the taxes that we pay, we put into that little kitty there, and the government covers the rest. Private people helps at times, but the role of the government should be that they should continue to help the elderly, because they have a system in place where they have a group of persons who do that. They go out into the homes and they check on things. That's good, and we want more of these people. We want that to grow. It's just a small group, and we want it to continue, but we want it to grow. We would like more training in the sense that they have more skills. Even having a nurse or two attached would be a blessing, because they have their limitations. And because a nurse will be added, or 2 or 3 or 4, then we will have the other part of the medical aspect to it, so that they can do more when they do visit. Not when they visit, they say you have to go to the hospital, when it was something so simple that a nurse could have dealt with it. So the role of the government is ever evolving, and we want to highlight, yes, they are part of the care system. I would want to believe they are doing the best they can, but I would like the community, or the person individually, not to depend on them so much that care is going down the drain. Things that we could work on now, things are becoming a little bit more affordable and convenient, and so that we can get things done. So let us not just wait on somebody, whether it's the neighbors, the community, or the government, to help in instances where we can do something. If we can't do anything, then when we have exhausted all the pathways, and of course, when we have prayed beyond prayer, every day you should do it. But let's say you're even tired to go to God now, you're fed up. You still have to try and pull some inner strength from somewhere and get the job done, because people's lives are dependent upon the loved ones. We are the bottom line. The loved ones are it's a big deal, and we cannot wait on the government to fly out anybody when they are sick. We have to do what we have to do now. Okay? Another area we want to look at is, why do we choose, or why do you individually choose to work with the elderly? Whether you're getting paid professionally or as a family member or distant neighbor or whatever. Remember, we are all caregivers once we have somebody to care for. Why do we do it? Why? We should be doing it because we love it. You can't be in a field like this and not love it. It would not be beneficial to either yourself in the end or the person you're actually helping, because you're not really doing any helping if you're gonna be abusive, because the end result of somebody who don't really love what they're doing is gonna be chaos and confusion, and we have enough of that in the world. In St. Kitts, we have enough of that. Excuse me. So why we do it should be because we love it. And maybe you're not thinking about, oh, I may really love that, but you just like do it. Okay, you have to like it too. Like it, love it. But the point is, it has to be a part of why you want to help that lady up the steps, because it just look like she gonna fall now because she ain't holding on and the rail good, or maybe there's even a rail. You have to want it. I think personally you have to want it. And even professionally, if you're in the professional arena, you really sign up for that, as we would say. It shouldn't be if you want to at this point. Once you say you're a professional at it, it means you're supposed to be doing it whether you want to or not. We have our down days, yes, but you should be wanting to do it because that's what you said you're gonna do. That's what your oath said to do, no harm. But when it's not a professional caregiver and it's just somebody who likes it, I don't think you go like it some of the time, then the rest of the time you ain't like it. You have to like it all the time, because work is always there. People always need help. So all in all, it goes back to the first thing I said about one is who you are as an individual that makes the difference in if you do something, why you do it, and if you love it. Now I'll touch on the psychosocial needs that are affected by the elderly or the older person. Depression. We just had the talk on depression, loneliness, dementia, Alzheimer's. These older persons suffer from these mental disorders. Why? Because everybody caring for them, they get the best crackers, they get the best of everything, but nobody talking to them. Nobody even listens. Nobody even asks, how are you today, Granny? The psychosocial needs that are affecting the older persons, the elderly, the senior citizens, are probably the last thing we think about. Nobody, some of them don't even speak. They after a while, they say, Mommy, stop talk. Excuse me, Mommy, stop talk. I ain't talking to her. She have plenty to say, but you ain't listening. So the psychosocial aspect to things is a big deal. We are in a house with somebody and we don't even know. We don't even, like a friend said the other day, you don't even ask me how I'm doing. Now I'm thinking, really? But she was probably right, because I'm so busy doing so much things. I probably just forget to ask who I need to ask, how are you doing? So imagine you see someone every day and you don't ask that, but then this person is living in the house with you. You're feeding them, you're clothing them, you're paying the bills, you're sheltering them, but you don't ever ask, how are you doing? You don't ever ask, you have any pain? You don't even ask, what do you want to eat today? Because you want to give them a little treat. You know them, I can't have most of what they say, because the last elderly person I asked, what do you want to eat today? I was like, she said she wants sauce and pigtail, and I was like, oh, I'm so sorry I asked her that now, because how to deal with that? But you know, you have to educate the person if they really can't have certain things, but you don't even ask. So because you don't ask, they feel so left out. You give them the old sappy looking oats, like in a winter. Thank you. And you slap it on the plate like you're telling them, take that there, that's all I got. Mind you, it might be all you have, but it look like crackers when you throw water in it and it, you know? No present, no niceness to it, no nice little banana cut up on the top. You just give the banana there, she can't even peel it. And you know what I've realized too? Even at the hospital, we have the big water them and the lockers. They're huge, and you can't even lift up one good. And the woman well wants some water, but guess what? The relatives ain't anything to do like this, bring a little nice, easy to open bottle. They bring in the big handle ones, they can't even lift them up to throw up the water themselves. And every day you pass it full. You can't open it, eh? Because maybe the nurse giving the water from their stock in a glass. But you come in every day and you see your mother water, you know, you ain't ask, Mommy, you want some? Because they get in the one from the pipe, from us probably, but then you have the nice bottled one, but you ain't giving them none. Because nobody open it, you ain't open it neither. So this is, and she knows that the water there, and she probably ain't even bother tell you neither, because she ain't want to burden you down. They like to say that, see, I don't want to burden you down. Burden down how? Burden me down is what I'm here for. Because when you get the thoughts out, I'm getting passionate now, hold on. When you get the thoughts out, then you will know what to do. But if you ain't getting the thoughts out, the person will just be there like a mommy. Yeah, the lady just there and talking. I thought she can't talk. I thought she was special, mentally challenged. When I started to hear her talk, I had to hold a seat because the wealth of information that was pouring out. It's like she's so glad she mouth open. She didn't want to hush. I said, I got to go and come back. She said, no, don't go. I said, well, when I done work, I'm going to come back. She said, you promise and don't tell nobody older that you promise. And if you know you ain't promise, tell the truth. Say no, me ain't promise. Don't bother say it. Because I had to promise and mean it. Because I had to sit down there till 6 o'clock and I done work till 13. To hear all about the dog, all about the coat and them, all kind of story. Because she's so glad. So the nurse asked me, well, she don't talk. This nurse was working. She said she don't speak. I said, well, what is? The woman and she speaks so fluent and well. She ain't even stumbling over her words. And this woman never talking. Because I only asked her how she doing, and that was it. I ain't even working on the water, I passing through. But I promise, and when I said I promise, I had to hold it. I had to hold my word and keep it, because that's how I am. And then at 6 o'clock, meet me there listening to all kind of story. And the nurse them can't believe the woman could talk. Can nobody ask her how she do? I only asked her because she look familiar to me. So the psychosocial needs they are depressed, they feel like they're burdening you down. And they need to stop feeling so. How to make somebody stop feeling burdened down from depression and lonely? You have to now find ways, whether you're a caregiver in the home or at a facility, find ways to make the environment friendly. Put on the news, and not the news all the time neither. They want to hear nice things too. Put on Beyonce story, they like news. Put on something, they like story. Yes, they'll tell you, guess what happened? Serena lose the match. How they know? They hear it. The TV ain't in the room, but they hear somebody talking, so they pick it up, so they give you the news when you come. And they tell you all about what happened, and they never even there. What down tongue, what going on, and they never go outside because they shut in, eh? So it means that their brains are actively working, but we don't stimulate it. So the psychosocial needs are affected. We are risking them going into a depression, and the depression kills, because from the time some of them move from the home or the hospital setting and they go to the facility, they die. Not from the condition, but from loneliness. Loneliness does kill, you know. I learned that it hard way. It does kill. Depression does kill. And not that they're overdosing on anything. They're just so sad and down in spirit that they feel they're a burden to anybody who try to help them. And they try to tell you, no, don't do that. They stop you from even trying to help them. So this is why we have to, as caregivers, we are putting it in one now. Be it the home, the facility. I'm not even using nursing here because you don't have to be a nurse, as I said. Once you're a caregiver, it means that you're caring for anybody. But when it comes to the elderly, we cannot forget this psychosocial aspect of it. Please, that's the first thing I think we should address when we meet anybody who is elderly. Let them tell you the lot of stories. Sometimes you might be so enlightened by what they say. You'll yourself learn a few things or two. We have a client, he's 96 years old, and they asked him to please write down all that he eats, because if he's 96, 97 now, I want to know what he eats, because then maybe I could eat that too, to look good, to live longer, because something got to be working here. And then he write them down. When I look, is that a guang food? I say, what? I mean, I gotta go back to the guang, the dasheen and the yam and all of that there. Because he didn't stop writing. I had to tell him that enough. Got to me the page he done and he still want to write. I said that enough. Because he glad I tell him what, and from that, anything he wants to say, he writing now. We don't want him to not speak, but it's good to see that he can even write at 96. Man, that's a blessing in itself. And he could express himself. If he can't find the words all the time, he knows how to articulate on paper. So please bear in mind the psychosocial need. It might not necessarily mean the most important. Remember, it's from my perspective, but it is important, okay? The nutritional needs now, the nutritional needs of the older persons are changing. They cannot eat the hard, crispy KFC with the skin so thick they can't even chew it. If they try, they're dead. We can't cook like that anymore as they age. Even us with teeth ain't even no good. As soon as you decide break up. You understand? We can't cook like that anymore. The nutritional needs are affected. You have to cook food. I don't want to say cook it sappy and runny or puree. People pureeing foods for people who have teeth, who could chew. And even when they don't have their real teeth, they have dentures, man, top of the line, nice dentures, look so nice and small. And nobody giving them enough rice, they're giving them sappy, even if it's ricey puree. No. When you do that, you take away their chewing ability. So, you have to prepare the foods that are soft but look good. Yes, you don't have to be, even if you're gonna mash it when you're giving them, when you're feeding them now, if you have to assist, it still should be presented like it's from a restaurant with a nice, and put it on a nice white. If the food is pretty enough that you have everything from the food groups, you put it on a nice white plate. If things hard and you ain't got everything, no lot of nothing, put it on a pretty plate. Lift it up. Let color be seen, whether it's the food or the plate. And then you give them. Don't give them a big plate neither, because no, they're gonna feel full before they say, "Me want all of that." Give them a small, nice plate, so it could look like it's a lot, but it still look a little bit, so that they could want to eat. They are risk for dehydration. The hydration needs are badly affected in the elderly. Sometimes you see them, they look crispy. You ever see somebody look crispy? Like they're ready to break. No kind of moisture. The skin is so dry and brittle. You want to know if this person even does rub themselves. If they rub themselves, the skin come off. They're dry because nobody giving them no water. Nobody giving them no water. The children in the house, and they ain't participating because you tell leave grandmama or leave. We're running off for. Let her give granny some water because you ain't doing it. That is why we're trying to get to the schools. We started already and we're going to continue. Let the children be involved in caring for the older persons in the home. Because you say, the water will be right over there. And I call him barefoot to pass the water, because I tell Lily too. Give me some, mommy the water. I said, no, but bring it still. Let them be a part of helping you. Because if we stop them, they will never give you that water when you really need it. When you really, really can't even open the bottle. I'll pause for some water now. They'll never even help you when you really need it. So the water can be right there. Please pass it, because I'm an elderly. So I practice for later down. You understand? So the same way in the home, the hydration. Many times they come to our doors at the hospital and they are already on death's door because of some simple fluids. And then you have to give them the hydration, SARS, the B complex. These things in town, these things available. but we don't know. We should have a little packet of hydration salt, and they have the mini ones now, flavored, so you don't have to mix that whole big bottle, and flavored because they taste terrible when it's the original, but they have nice flavor ones now, and you don't even have to buy the big Pedialyte. The Pedialyte, yeah. You don't have to buy that big one. We're gonna have to waste the nice packets, and you mix it in a bottle of water like that, and you get some electrolytes in there, because they are using the bathroom, they are going off, they are defecating, they are urinating, but at the same time they're sweating, and nothing is putting back. Only when you give them some food, they get in, and you ain't even giving them what you're giving them juice. At this point, when you're aging, you should be really cutting out the lot of juice. We all have over here. It's a healthy juice, that's iced tea. You really should be, and we don't have lemonade, but you really should be cutting out the lot of juices as they age, especially the diabetics. So we have to incorporate water, even if we have to set the phone for drink breaks. And if you're leaving them unattended, put the little, even if you have to put 6 cups and put them, not in a bottle where they can't take off the cover. Cover it with a little saucer so they could get to it quick and fast, and keep them hydrated. Let the children be involved as well. Constipation, because they are not mobile anymore. Most of them are. Even the mobile, they don't move around much. You have to make sure that they are hydrated, because constipation is the next problem, where they are backed up so badly. They start to get sick. They ain't have no pressure, sugar, nothing, you know. But they're just sick. Why? They're losing weight. They feel, it's like they're just looking horrible. The stomach hard like stone, because the stool is in there backed up. You let it go on so long, when they try to force, putting strain on the poor heart. The heart done aging already. Remember I said we aging? They ain't had no heart condition, but it hurt in the chest to even force. And we know how we could feel, as you know, you don't feel, right? When you're trying to get, and you feel like, oh, you feel like you're dying, and you're young, you know, you ain't aging like that, you ain't reach 50 plus. Imagine these people who have heart condition, blood coming because he had. They're uncomfortable, you know, we could feel uncomfortable when you're trying to pass your feces. You could imagine that in somebody who don't walk, who in the bed, who have conditions to add to that problem. No man, we have to do better. We have to do malnutrition. The pure thing ain't working out. Stop with the people. I had a client, she said, I don't want that. She tell me she want what I have for lunch. Because one of the things you to do to help them eat with them. The girls at care nursing agency does that, and I never tell them somebody to eat with the patient, whether it's they prepare the food and they eat, or they bring their lunch and they eat with them. But the people telling you they want that, they want that. I said, well, this is what your daughter pays. She said, no, that tastes like, can't say the word on TV. Don't want that. It's food, you know, she blend up the chicken, everything together, think it's so nice. So nice, it tastes horrible. She said, taste it, you see. When I taste it, you know, I can't pretend now. I say it tastes bad. She said, and they expect me to eat that. So then she want what I eat, so I have to ask permission, of course, because remember I cooked it. And then she said, well, can you cook for her? No, that's added work now, you know, because you're tired and you have to go cook food. But because the woman's so willing, you knock up something, a quick thing the first 2 times, and she like that. And you look now the woman eating from the family pot again. They gain a puree and they never know she had teeth, and they teeth them in she mouth. But because we so think they're in the bed now, they're old, we treat them like babies. They're not baby stage unless they're really critically ill and can't help themselves. As long as they could talk and help us give the people them their food. Chip it up small, but present it well, and then cut it up, mash it up when you're feeding them or helping them. And the lady started eating regular. They were so happy. They said, no, sir, I'm so glad you're here, because I'm tired of the puree and thing. I think I was a master puree. I know the thing. I said, certain things shouldn't be blended together, you know. Certain vegetables shouldn't be blended. It tastes horrible. And all this time, they never tasting it. So you're giving somebody something, you know it tastes, and they're telling you. And they're afraid to tell you because they feel like you're going to feel bad. So they're telling the caregiver now, the other one, the professional who comes in. And you know, might not even say anything because you feel you don't want to offend the family. Well, I guess I'm an offender, because I had to say it, because then it would have continued and this person would have died of just to get a burger. Because she tell me she really want pizza. I said, let me see what doctor say about that. Because she started to tell what she want. I think she didn't want too much things and I hear me, you want what? What I tried to work out, what is me now? She say, you know, one name, so whatever it is, I did not to go ask. Because she telling me all kind of things from long way back yesterday. All of a sudden she want treat day. I want to tell her about a treat day once. She said, remember you said we could have a treat day? I say, she said I could hide twice a week. She telling me what days to hide too. I did tell her Sunday for that. She said no, Friday and Sunday. And the daughter was so relieved. She didn't offend it. It's how you bring across things. But she said she's so glad she fed up at the purine too. Not fed up at eating it, but fed up at doing it. Because there's a lot of work to pure things. So malnutrition is a big deal because they don't get to eat from this food group. So that's where supplementation, I'm a big fan of that. Supplementation is important because we don't sometimes have the time, the energy, or the monies to buy that what is necessary. And because we don't, it means that we have to supplement. We're not gonna get it every day. I don't get to eat nuts, I love it, but it's expensive. So you get the different things that you need. And sometimes you get a lot of that from your legumes and your peas and all these stuff that we think just lying there. See, we have some nice lentil patty here, you know. We can get some good things in today. So these are things we could do. Incorporate recipes to make it look fun and attractive for them to eat. And you might feel good too while you do it. So the nutritional needs is a big deal for us, okay? Safety and security needs now. The fall ratio in St. Kitts is so high. We have a lot of hip fracture. We're gonna have Dr. Hendrickson coming in to speak on hip fractures. We have a lot of that. After the hip fracture, people are there. Not from the fracture, you know, because they know suddenly their life is cut short. They can't move around. This person used to be very much shopping away, and they can't run away now. They're gone dead because they're depressed. That's where the psychosocial need come back in. They cannot do what they used to do. They can't hang out, drink their 2 little beer. They like you tell them about take the might farming. You want to might farming, you want to skull. You understand their lifestyle change. They come elderly now, like they're 48 and they're the elderly because they're disabled, you know, the hip fracture because of a fall that could have been prevented. Of course, out the bed. Sometimes we bed them so high and fancy now. When they fall, it's like better they dead. Because everywhere fracture now. The fracture them happening so fast and so often. It's amazing that they live. Because one of the clients had to fly out twice from a fall, bleeding in the brain. He survived the surgery. He's a strong one. But how much fall he could get? Sometimes the fall is a stroke. When it happens, you don't even know it be. Vagadam or seizures. We're going to have stroke and seizures coming up. These things happen because of safety and security needs. We have to address it. You cannot have the fancy thing on the bathroom floor and sliding person. You can't have the bed high. Get the people cut off the fourth leg, like come down a little low. Let it fall and fall good. The falling will happen, but let it fall good. Not from a height. Make the house friendly. Accident prone. Make the bathroom, they got the nice fancy things you buy. You have cheap, affordable ones. You don't have to get the comb. You know, you don't have to have gold and brass. You could get a copper, it don't work still. You know, we too, some of us, we too materialistic that we don't realize that to get these things that assist with caring for the elderly in the home or the facility, we don't need to spend a lot of money, but we could be creative. Get the toilet attachment so the toilet don't be, you know how it is to get up. Let me try here, because is elderly too. Get up and then you got to go right back down again on the toilet. But they ain't gonna use the bathroom, they're gonna just pee in the pamper. Even they could pull it down and they have a pull-ups. Because the toilet seats are too low. So if this person used to always use the toilet but they're getting down, expect them to go on the toilet. They're gonna start to defecate in the pamper now. And they're gonna want to tell you and say to too. They're gonna want to say the toilet seat too high and say, Lord, she done ain't got no money, she done balling body went. She can't. They ain't gonna tell you. So you don't know that the toilet seat, they have attachments for them. And they have this thing you put up to hold on to. If you don't get a nice one, you got a lot of carpenters around, could build piece of wood, cut off piece of wood, smooth it down with a little varnish, and you hold it and to help them get up so they could done with a lot of pamper. You got money? They don't need a pull-up when they could help themselves. And they gotta come out if they want. These is people independent and wanna go to the bathroom still. Those have their pride, but they can't venture to the bathroom because they can't make it. But they could come off the bed and go on the nice, come out. They're very cheap. And you don't even have to buy the fancy bag where they're telling you on Amazon with it to come out, no bother with them. When they finish, you go try it away and you wash it up, put in a little disinfector, put a little tip in it for the scent to stay down, and you're good. You ain't need the fancy bag to keep replacing. That's just a money mechanism there. Money scheme to get you keep buying. You could wash out the same thing in the commode and you ain't have to use the fancy bag. But if you got somebody visiting to the put you on the fancy one, because they got nice scents and so. But it's you. It's all up to you and how you see things. Ask a question, come, we'll talk to you, we'll warn you. So we have a lot of people who sell these products. We care so that you could use in the bathroom and a nice little fancy little bath chair. If you don't have no money, a nice sturdy plastic chair will do. When you finish, you let it dry. Make sure it ain't shaky. You test it out so you could fall first. You know? It has a lot of things we could do to help prevent these falls. Pad up the bed. Don't make the bed one in ceiling mattress was so hard. Let's get bed sores. Yes, you want them get the best name brand, but anybody care? Nobody care. Get the nice. They got the egg crates. They ain't gonna also, but you got the nice egg crate mattresses now. They come like that, and if that's too costly, they got the thing you put on the bed, and you got you plug up to the electricity, so it could stimulate blood supply in the whole of the back and the legs. And sometimes even if you have to pay a little money, it's okay. We don't buy weave for $800 and more. We don't do a lot of things with money that nobody even care after that day. You done gone and nobody even remember unless you go back to the pictures. Me, I remember when they buy the weave for $1,000, you know. And baby, you ain't got it no more. So then you could invest in a nice, proper bed that helps with stimulation as the person age. You know, so that you don't have to deal with a bed sore because you have already practiced looking at things now to make them comfortable. So as they get older, because remember we say aging is a process and it's natural. I believe I'm gonna get one day bed for me here because when I lay down I could get my massage without paying anybody because I got me thinking just plug it in. Yeah, we have to wait till we old to start practicing to care for ourselves now. So that's the safety and security aspect of it. Skin integrity. You right behind because remember I said the ulcers are a risk. Bed ulcers, bed sores, infection is right behind it. Because if you already have a break in the skin, that is what next. Because sometimes you bring them when they're on the verge of dying because you don't reach the bone. Once you red and look angry and brown or dark red or brown, depending on your skin tone, that's already stage 1. Stage 2 is when the skin breaks. Stage 3 is when you're seeing a lot of things in there, you know what you're seeing. And then by that time it smells too. Stage 4 is when they bring in you because nobody wants to smell nothing now, eh? They lighting up the house. So they bring in you that time. And then you ain't complaining. The elderly person not going to complain because they don't have no pain. It's a dead area that is, you know, once pressure is in an area, it becomes necrotic. Sorry, it dies, no blood supply there, and necrosis steps in because no blood supply going to area, you're gonna want. That's necrosis, and then they don't have any pain. So then you're gonna get bad. By the time you open it, it's straight to the bone, and infection already start, and then you go in the bloodstream. 2-3 days if you don't, I mean, we could be aggressive or what, the person might still end up dying. And you don't have to be an elderly to get this. If you come with another condition and you're on your side for long, your ears start to break down, your elbows, it's a reality and not just for elderly, older persons. All of us in here, we lay down too long on a side, we feel like we're dead. You could imagine the woman in the bed and they ain't moving and you ain't even give her a little ton shift or so because she can't do it, she can't even scratch if somewhere itching. You ain't even have anywhere scratching you. We probably don't even remember about that. And they can't move and they don't ever get to scratch. You know how much time you could scratch in a day? Because we deal with them, we forget that these things matter till it happened to one of us. So infection in skin integrity is it. You can't be rough. You can't be rubbing on them too hard. They break the skin. Sometimes we as the caregivers cause damage to the skin. that we can't change or fix, because when you try to rub off that pseudo cream and those thick barrier creams, you're causing more damage. Why? Because you're breaking that nice skin, but what the skin loses elasticity as we age. You don't see everything drooping and dragging, the breast down here, everything sagging, because they had a nice, vibrant, the skin crazy, wrinkle, and if you ain't hydrated, the brittle. All of this happening because we are going through the aging process. And believe you me, we have been seeing the changes, you know. If you really take off your clothes, I'm going in mirror, pray you don't faint, but look from head to toe, and you're going to see so many changes. You say, I didn't see this. Look in a long mirror, and you will see all the changes and start happening to you right now. So skin integrity, that's the biggest organ in the body actually. Our skin. Everything got to do with our skin. What we put in our body, everything, the skin is so important. It's covering all the major organs. So we got to take care of the skin. Buy the nicest cream if you have to without the lot of fragrance. Buy the Cetaphil and all those. Buy them. Lubriderm, buy them. Stop with a lot of fancy Avon scented one. They ain't helping you. They ain't even keeping the moisture for long. Buy the higher end brand ones. It costs a penny, but it's worth it. It's really, I don't even bother with that. I don't use oil. Because right now, nothing keeping the skin dry, especially as you go down to the lower extremity. Everything dry up down there like chips. You do so, it's white. Embarrassing you in tongue. You in your nice sandals and your foot look like chalk. Yeah, these things only made for fanciness. What is just all fanciness? You have to be smart. When you're dealing with the elderly, as you get smarter for them, you become smarter for yourself. Because remember, you had to want it for you. That's why it starts with you. So when you start to care about you and care about how you feel about people, you're going to do better for people because you're done doing it for you. May bother with the fanciness no more. They have good ones, really good ones. But the oil, olive oil, cooking oil and all, if you got any oil sheen, they don't made up on the oil sheen. I ain't had no time to bend down to rub no way. Put on the little oil sheen because it's oil based and it keeps the skin more subtle. I'm rounding up to come to an end. Okay, thank you. Neglect in the home, even in facility care, it happens. It is happening. We ain't pretending it's happening. Now, the reasons for it happening could be a lot of things could play a factor here. We won't even touch on the reasons because they might be legit. They meaning it might can't help it then. It could not be avoided as we would say. But it doesn't matter what the reason is. Once there's neglect of the elderly, we have a problem. And a serious one too. Neglect could lead to so much other things I said before, depression. They start to feel, oh God, it's a burden. Meaning I'm about to tell her that I tutu again and just leave it in the pamper and me ain't gonna say nothing. And because you know neglecting the situation that, me really check this person pamper for the day. I in the house with her, you know. And because she ain't say she tutu and she could talk, me ain't check. But she tutu and ain't tell you because she feel embarrassed. She feel shame. And the pamper steady with the peak and she put 3 times to her. And the stool, and guess what? What did I just talk about? Skin integrity. But you see this now with elder neglect, everything ties in. The neglect lead to the the poor skin integrity, the bed sores, the ulcer and infection, because you know neglected the fact that you had to do this. And the person who is in ailment, whether it's a loved one, the client, the patient, whichever term you want to use, the person now realize she feels alone. If I call her one more time, she hit me because I don't call her 3 times for the day. And they check in, you know, in the morning, they say, I don't call her 3 times for the day, me ain't calling her again. Because she feels alone when I call her, so vexed. Let's say, let me don't say you. Our facial expression tells a tale, you know. People go off for how you look, even if you ain't mean it, your body language, your non-verbals. You watch her funny, she say, if I call her again, she gonna just ain't come. What if you call her and you send her next nurse? Or if you call her and you send somebody, you know, the next time she say, me ain't calling her again because when I call her, she sends somebody because she ain't the one to do it. This time you're busy, you know. Ain't that you mean you send somebody else to do that because you were busy doing something else and you probably didn't want to stop. But remember I said the reason ain't matter. The neglect is happening, and once it happens, it affects skin integrity, psychosocial needs, the way they think and feel comes into play now. The ones that we didn't remember to deal with, the first thing we have to look at when we enter the person's home or sanctuary or facility, all of this leads back to that. So they're not going to tell you the pee 3 times. They're going to be like, I ain't gonna bother telling you here. And this is another thing to get to me. You change your pamper and don't even wipe off that urine. How are you going to leave it on? If you leave it on, it's as if you leave it on the pamper, because the skin already has the urine on it and you didn't use no barrier in first instance. So this skin is absorbing the urine, which would now break the skin integrity over time. And the over time is very rapid, because you're just changing a pamper, you're not wiping off that urine. So this is another thing you cannot, is a form of neglect. To change a pamper after several times the person urinated, and then after the 12th time, the pamper's so wet, the urine all over around the bed. But no barrier cream they put in place. Even if a barrier cream was in place, you just change the pamper and put on the next one. That's neglect to the highest degree, and it's so simple. But you're rushing to finish something else. You're in the people's house, but you're trying to catch Oprah 10 o'clock. So you hurry up, eat. You're sly, How you speak to them, hurry them up to finish, to hurry up to watch Oprah 10 o'clock. So the woman is choking, him realize she's choking. All when 10 o'clock she still got food in she mouth and she tell you she done it, but the thing in she jaw. When you go 12 o'clock in there still because you ain't him now. You ain't paying attention. Neglect is happening all around us. We shortchange the elderly, we try to cut costs, do things smart. We ain't working smart, we're being really neglectful. Stop it. Caregivers in the home, stop it. Caregivers in the facilities, every one of them in St. Kitts, stop it. Or you're killing people, family. And the thing is, we might be one, we're going to end up come in that same position in whatever capacity. And we ain't going to want it for we say, we don't want to tell them how to do their job. No, remember, you ain't wipe your off, because you don't hear it on the TV now. And that I said, we talking about it. When you come in a situation now, you could go on if your hand break or your foot. You're going to remind the nurse now, you're going to say, nurse, remember that they don't sit down there on the thing on the care nursing agency thing. I don't wipe it. I mean, everybody, stop it. Because when you become the patient or the client, you will remember what you want for you. So don't do it. Do not do it. And if you see anybody doing it, tell them stop it too. Tell them Keisha said, stop it. Wipe off the people when you're in the house and stop wait to go to watch you ever making your own plans on the people time. Stop it. It's wrong. It's neglect. And then we're going to move right to elder abuse. I'm very passionate about a lot of things because everything intertwined, as you realize, because I could go on and on for days, but time would not permit me. But with the elder abuse, it's happening right in front of our eyes. The way we speak starts it, because before you even touch anybody, the way you talk to them, like they stop it, like they hurry up, eat, because you know in your mind you have to go and watch the show, but sometimes they tell you, hurry up, I got to go. I don't work, You can't tell people that, but people do it all the time and they think it's normal. They're telling off the people in the house. Imagine that. And in the facility, like you is some boss. You is a human being and they are a human being, but you're telling them, even in the family, I only looking after you, you raise me, you raise the rest of them, me the black sheep, but only because. That's what you're telling your mother. Or your auntie. They ain't paying me, They're paying the other people, they ain't paying me. I only here to give you the little bit. Anyway, hurry up, buddy. I ain't doing no egg for you tomorrow because you ain't working no way. They just tell them so. Yes. If anybody tell me something else, so shame, I ain't bother want to eat. Me want it again. And then when you look now, you say, well, you ain't want it? You say no. How you mean? And then you get vexed again. So you make me prepare all of this here and you ain't want it. You say you like to waste people time and people money? Eh? And don't they, and you know they ain't gonna tell you they're gonna pay neither. Cause if she done gone so with me for breakfast. Lunchtime and he want the lunch. God. If me ain't through the chicken fast, she might say. But you ain't gonna done through that day now. So before we even touch them to do things that they need us to do in terms of caring for the bath and all of that, just by speaking alone, what you think some of them don't eat from you? One day in Chosika, if you don't answer me, you know, I know from she look like she will kill me. They have their own thoughts, but because of psychosocial, the aspect of it that you didn't address, you didn't say, good morning, how are you doing? You know? They don't want to trust you, they want to eat from you and they feel bad. And they shame very easy. And that we got to cut it out. Stop it, man, stop it. The neglect could lead to abuse. You honestly really just can't help for certain situations. But tell somebody else do it for you then. And then the abuse wouldn't, because right after neglect is the abuse, just peeping on the corner and say, hey, the abuse right there waiting. Because it's happening and you don't even realize you don't cross the line with how you speak to them. Disrespectful in the people place. How you guess so? You're going to tell him, hurry up, I go work for 8. You can't tell the client that. And I ain't doing a toast bread. I ain't cleaning no toast oven. That ain't what are you here for. You're going to get the bread in the microwave. You know how microwave bread tastes the toast bread? It hard like kitchen, but it tastes like dry bread like you ain't on a body. Horrible when it get hard. But the toast one is a different feeling when it toasts. And you're telling them, remember I'm doing you a favor. And you're getting paid. And even when you ain't getting paid, how dare you tell anybody that in their place? So the abuse starts from the words we speak. Then you go on to physically hitting people. Sometimes you ain't even hit them, you grab them up. You just see I can't watch them there. I don't care what it is. I cannot watch a video with somebody hitting a child or either do something to me. I refrain. When I see it start, I lock it off. I could see a killing. I could see anything, vomit and blood. But when it comes to abuse, I can't watch it. My heart won't allow me to because it hurts me too much. Once or twice I get to see it. That's how I know I cannot cope. When they drag the child, I was like, this real? The same way that I do the elderly them in the home. Bang them up, box them up. Some of them so smart. The smart ones, them who think they're smart, they will try to do it in places where you wouldn't see. So that the care person or the person in charge of them or the loved one, the family, wouldn't even notice. Because they do it on the bad, not on the outer extremities like the hand and so. They will push them down, do things like so that nobody could know you do it then because it's not visible. And the family members do it too. Yes, they do it too, and it's sad. But any family member at all, and I'm on TV now, ever abuse anybody on the care nursing agency, watch, we will call the police. I will call the police myself. I will come with the police. Even if I'm not in the home, I will leave my house, my bed. I don't care what time it be. I'll be coming with the police for you. Because it's real, it happens, and we want it to stop. Because you're paying somebody, it don't mean gives you the right to do something like that. And we know about it and we're gonna stay silent. They don't have a voice. They are afraid, they're embarrassed. We are the voice. So everybody in TV land and who is here today, if you see this happen, it's a delicate way to deal with it. You don't have to approach the individual to get in any confrontation. You just simply say something to the right authorities, the necessary authorities on the matter. Put it out there to the authorities. Don't spread the word in the community. Don't do that. Go to the authorities privately and confidentially. I ain't private here telling you I'm going. So you're done now. If you're hiring us, be aware. So then if you know you're going to abuse anybody and we know, don't bother. Because we ain't accepting it, okay? Way forward. For us is each one help one. How can we help the elderly or the senior citizens or the older persons? It's a mouthful I spoke today. I'm happy that I got the chance to talk on this topic because it's something that it's it has a lot of aspects. This is just a few points I touched on because of time. But how do we go forward from here? I've said a lot. What do we do to help the situation? First, we have to start by treating ourselves well. I think if we work on us, we will then be able to help other people. Because if you try to help other people without working on yourself, like I said, you'll do it sometimes. And as I said, caregiving is all the time. Let us do a little more for each other. Let's speak good things to each other, to ourselves. Say, look at you, you're so beautiful, you gorgeous thing, you. Talk to yourself, tell yourself, oh, you look so pretty today. And then, you know, you're going to start to feel like you look pretty today. When I do it in a work, sometimes I need to do it more. But the feeling you get when you comb your hair, you change your wig, you put in your weave, you polish your toe, is a feeling that nobody could take from you. It's the same way when you comb the hair. You could put in a weave, especially if you know the person was a glamour person, polish up their fingers and they to make them feel just like how you would feel if somebody did it. Make them a nice breakfast and make sure they could eat what you make. Tell the neighbors when they visit, mommy don't eat this and that here, but if you bring it, if you bring a fruit, don't bring the grapes, it's kind of sweet. So bring, you know, communicate with the people in the community who you know. Just pass by. In fact, have a little party. Like we're gonna have one right after this. And the party is because of the type of food we're gonna have is for elderly anyway. Have a nice party, no music. Just invite the people who you know to help your mother. Bring them over. So we got a little thing, 7 o'clock, come through. Or if you want, surprise them, do it the time and you know they're gonna be there. Bake up some chicken, do something. Food bring people together. Eh? For me, that is a must. It's a must. But for you, it's a new way of doing things. Let them be involved, and while they're chatting with your mommy, you know, or your auntie or whoever, say, listen here, mommy ain't to eat mango. Mango season come. I know she like mango, but you're gonna be a very small one. Maybe one a week, not one every day or 6 or 21 times. This is your chance to educate, because that's what you're doing. You're teaching the neighbors to do better for the mother or the auntie or whoever the loved one. So it starts with us. So we too shouldn't eat the 20 mango. I know somebody in here tell you to eat 20 mango and so. So we know the diabetes is real. So we're going to cut down to 10 and then the next year go down to 5 again. I know you can't go cold turkey. The whole point is doing little things that help. Talking to the government, go and see the people who assist with the caring and going around. Say, nobody really there this kind of time. You could drop by mommy, even if every day. And they might work out something with you. They might work out something with you. But if you never ask, go to We Care. We Care is an in-home service provider. She sells stuff to assist with the needs in the home. Go to her and ask her what kind of devices she has to assist with the lifting. She has wheelchairs and walkers and stuff like that. Because after a while, they need help. You can talk to anybody here at Care Nursing Agency for anything. But the point is we have to educate the family and the public, the communities. And we even could educate the government, because some of the things that we are lacking, we could put a proposal together so that the government will know these are things we need to have more of. And stop by the latter that day, because nobody using that. They're wasting all your money. This is what we need. So we could help the government too by assisting them in what they actually bring into our doors, because we have a lot of things and people waste them, you know. Family planning is one. If they were utilizing family planning, would we have so much children studying right now? No. So we need to go back to the drawing board. That's why I say going backwards don't necessarily mean that we're going back. It means we're trying to see where we were then to now, and we realize we're really working out. Sometimes we need to go back. And I'll end by saying, all the talk in the world ain't gonna help if you ain't got no money. If you ain't got no money, it's like as if you ain't exist, because we need money to function. But help is always available when we tap into resources that are available, but nobody that asks. Come and ask us a question. Ask any care provider who really passionate and care for true. Because remember, you got somebody in care for true about what services we have to offer. And with money, you might have it tomorrow, way high, way strong away. But guess what? Insurance is a big deal. And we need it. We need medical insurance. But guess what we need too? When our loved ones is at a critical point in their life, they need some kind of procedure done, and we don't offer it and saying, is what we're going to die? No. If we loved one needs some kind of intervention and we don't have the facility here or the equipment, what we're going to do, lie down and die? Because we're poor? No. We should have options. We should have things available, but it's not always so, because we have to wait sometimes. And the waiting might mean that we're going to die while we wait. So here's where insurance comes in. So everybody in TV land get insured. Sometimes there are affordable packages, but you have to tap into it. So Care Nursing Agency have tapped into one that we see is affordable and it's necessary. Getting your family or loved one out could be at a critical time when nobody got the money rest on. And another thing too, we got money rest on, some of us, but it's for your own business. Because at the end of the day, if 3 of you in the family member have your money saved up, you're going to build your house, you're going to buy your car, you got your child on the way, but your grandmother sick, you know what you're going to say? She ain't dead anyway, she don't live, she live. Some of us like that, you know, but nobody asks you to interfere with your money. We just want you to put together and put a package in place that if whoever the person, older person might be your sister, it might be your grandmother this time. You ain't gonna let her dead. You ain't gonna let nobody dead, but you might not be able to do it, or you might not uproot what your plans were. So there is where Massa comes in. So I'm now gonna introduce Massa to come to the front and speak to you about what they do, who they are, and what benefits. We have the elderly people. Remember, we're talking about people who are older, not necessarily aged. We are aging, but they might not be old people. People who could utilize a service that if any event of an emergency comes, we don't have to uproot every family from all over the globe, and then they can't agree and they disagree. Remember, me and they talk to she, you know, and me on the money. No, Massa is here to help you, and of course, with your insurance. Okay, so thank you for coming out. Thank you for those in TV land for coming. I'll introduce the representative from Massa to speak.
Hey, good afternoon, everybody. We're happy to have the opportunity to be here. Keisha's presentation was very informative and really amazing. I mean, I even learned something from that. I was on my phone actually sending messages to family members about just something that you take for granted, you know, like, you know, maybe it's time to consider a shower chair, maybe it's time to consider a nighttime bedside commode. So I found it very interested and I learned something from that. So we are always happy to be partnering in any way with Care Nursing Agency. Like we always say, they put the care back into healthcare and home care. And as she was mentioning, as an extension of that, we are here from Massa to show you how we care. My name is Dwayne Strong. I'm the manager at Massa Assist. And the lady to my left is Marla Hobson. She's on my left side today, but she's usually on my right side because she is my right hand. And she is my senior agent, a young lady who is very passionate about what we do. And what we do pretty much, and she'll explain to you in more detail, but what we do pretty much is we provide peace of mind and we protect you against catastrophic financial losses. And just so we can get this out of the way, we are not an insurance. We actually work alongside your insurance to make your insurance work better for you. And even though we operate a lot like insurance, we have some differences, and which she'll explain that in a little way. I just wanted to, you know, just some questions I just wanted to throw out for people to start to think about where our conversation this afternoon is going to be going. And it's not so much a presentation, but more like a conversation, a crucial conversation. And some of the questions you have to ask yourself is one, what is your plan for in the event that an emergency should happen and you need to be medically evacuated off of St. Kitts and Nevis to go to someplace else where you have to get necessary care, life-saving care? What is your plan? Now, the Federation has, in my opinion, good healthcare facilities, and we are a growing country. And for a small growing country, I think we're doing very well. But there's no country that I grew up in the Virgin Islands. I lived in St. Croix at one point in time. I'm an EMT by profession, 25 years now. So, I mean, even in that arena, they can't handle every single situation that they're faced with. St. Thomas can't either. Even in the United States, you go from place to place based on your needs. So, undoubtedly here in St. Kitts and Nevis, that needs exists. So very often people have to be medically evacuated. As a matter of fact, even today, we are speaking to clients who, one client is already in hospital and may have to be medically evacuated after suffering a stroke. We have another client that's in Nevis that's actually being transferred over to St. Kitts right now because of some medical complications and may have to be medically evacuated. We have members who are actually overseas right now dealing with family members, so because we cover you worldwide. But the point I'm making is, how comfortable are you and how confident are you with our ability here to handle every medical emergency? And when you answer that question, if you say, well, I'm not 100% comfortable, then the question is, what is your plan? We always plan for things. We plan for carnival. We're having no carnival this year. People plan for birthday parties. People plan for weddings. People plan for all sorts of things. But how many of us really plan for medical emergencies? We actually take it for granted. We don't really worry about it very much. I mean, when you insure your car, you don't insure your car because you intend to have an accident. You don't really want to touch anybody's car. You don't want anybody to touch your car, but you do it just in case. When you take your time and you build your house and you insure your house, you're not insuring your house because you want it to burn down or you hope a hurricane come and tear off your roof. But just in case that happens, you want to have something to be able to protect you. And here is where we come into as well. A little bit about our background. We have been around since 1974. We were actually the first company, we were the company that actually invented prepaid air ambulance service. Before us, there was none. Every other company that has since emerged, every insurance company that now offers it, has been doing so because of what we created. And we appreciate that because we think it's something that everybody needs. And obviously, if your insurance is offering some part of it, then such is the case. That's good. And we have over 2 million members worldwide. And since we have been in the Caribbean, since 1991 when we came to the Caribbean, we now have about 45,000 members around the Caribbean. We have offices from Bermuda all the way down to Trinidad, about 18 different Caribbean countries we have. We're going to be opening 2 more countries in 2021. In St. Kitts and Nevis, we've been here since 2008. And unfortunately, a lot of people still don't know about us. And we have about 4,000 members here, roughly thereabout. Last year in 2019, in the Caribbean region alone, we did about 686 medical evacuations. So that means there are 686 families around the Caribbean who had the need, and we were there to support them and provide that for them. Now, this doesn't account for the amount of persons who needed to be medically evacuated but weren't members of MASA. And one of the things that I want us to think about is, while I can agree this is not something that you're going to use every single day, I'm sure you agree it's something that you would want to have and really hope to God that you would never need to use. So what I'm going to do, I'm going to turn over to Miss Marla Hobson, who is going to tell you about the benefits that we offer for our members. When you become a member of MASA, what you can expect to receive. Ms. Hobson?
Thank you, Mr. Strawn. Good afternoon, evening, everyone. My name is Marla Hobson. I'm a senior MASA sales agent. I started last year, August, and I'm very proud to be a part of MASA. I feel the need for it as we give persons peace of mind. So what I'll do, I just briefly explain the benefits. Our basic is the emergency air transportation. If you're ill, sick, or injured and you cannot be treated locally, we take you to and from the medical facility. We provide escorts because I'm sure in a life and death situation, you would feel comfortable knowing someone is next to you, right? You get to select a family member, a loved one or friend to accompany you on the air ambulance. And the escort you select, if they use any hotel, food, or transportation while being overseas, we will give them back a $300 US reimbursement, providing their receipts. We have the non-injury transportation. In the event the escort cannot come along on the air ambulance, because probably in your condition you take up space, plus our medically trained staff on board. Once you're going to be hospitalized for 7 days or more, you get to select a family member, a loved one or a friend. We will give them a round trip to you. So someone will eventually visit you. We have commercial transportation. This is in the event you have to go overseas for treatment. Of instance, if they cannot do a head scan here, they say you have to go overseas to get it conducted. Master would pay for your round trip commercial coach airfare. Once you get the doctor referral and once you're going to be staying overnight in the medical facility, we pay for your round trip commercial coach airfare, which is unlimited service. We have the ground ambulance transportation. In the event you're hospitalized here, what we do is a bed-to-bed transportation. We take you from the hospital to the airport, from the airport to the medical facility. We don't just drop you off at the front door and wish you good luck either. We make sure that there's a doctor that will accept your case, bed space available for you, and you have to be stable enough to fly. So those are the procedures we take in order for the ground ambulance transportation. We provide returns and recuperation. In the event your hospital is overseas but you feel like you want to come home to heal around your family, friends and loved ones, we would bring you back home. We have return transportation. We could all agree that when persons travel on vacations, we don't know what could happen. Anything can happen at any time. In the event you're away on vacation and you got into an accident, God forbid, you have to be airlifted or you're hospitalized. Once you recuperate, we would bring you back home. You provide the discharge papers. Once you stay overnight in the medical facility as well, we would give you back a reimbursement for your return flight, providing your discharge papers and your ticket receipt. We have pre-existing conditions. We cover them after 3 months. So if you're treating a diagnosis for the past 6 months, like kidney, heart, lungs, asthma, diabetes, as Ms. Rawlins explained, you're coming to us as a new member. With that condition, you have to wait 3 months in order to use the benefits. Okay?
Which is fair.
Thank you. We have minor children, grandchildren return. In the event you're with a minor and you as the adult have to be airlifted or hospitalized, in your condition, you won't have to worry about the safety of the minor. Master would bring that minor back home to the next of kin with a supervised adult. We have vehicle return. Some persons, when they travel, they rent vehicles, and some of them drive carelessly as well, get into vehicle accidents. So, once you're hospitalized, the vehicle is parked, and each day the rental fee goes up. So what we do, we cut the cost of that by taking the vehicle to the rental place or business. Or even if you have your own vehicle, we will bring it back to the nearest airport for you. We have worldwide coverage. Master basically covers the Western Hemisphere, USA, Canada, and the Caribbean. If you decide to travel outside the area we don't cover, you would have to present a travel itinerary 10 days before your departure with a written, fax, or email. As a member, we have to know where they are to make sure they're fully covered. So for example, if you're going to be traveling to England, Master does not fly all the way to England because in a life and death situation, time matters most, and you probably won't survive that flight to England. But once you're going to be in England and you let us know with your travel itinerary, 10 days before your departure with a written, fax, or email. If you're going to be in England and something happens to you in England, God forbid, you're hospitalized or need to be airlifted, what Master does, we pay the air ambulance there to get you medically evacuated to the nearest medical facility that will accept your case. Mr. Sean, you can feel free to stop in if I leave out anything. Also, with the pre-existing conditions, we have organ retrieval and organ recipient. In the event a member needs an organ, we bring it to them. We don't decide who gets the organ, but once it's available to any of our members, we bring it to them. If they need to be taken to the medical facility for the organ transplant operation, we provide that service as well. These two services, they take a year to qualify. And that's where the pre-existing condition comes in, where you have to wait 3 months in order to use the benefits relating to the pre-existing condition. We have, lastly, mortal remains transportation. Does anyone know the cost of getting a body or loved one back home?
Over 50,000 EC?
Yes, it's very, very expensive, and that's just a range as well. It ranges from 10,000 US and up as well, according to where it's coming from. In the event any member passes away while overseas, we bring back the body or remains. The family member normally works out the embalmment and cremation, but Master will definitely make sure that the body or remains is brought back home. And those are the benefits we offer. I'll hand it back over to Mr. Strong.
No, thank you, Marla. So I'm going to ask you a couple of questions just for conversation's sake, and so you will answer. These are just some of the frequently asked questions. So How much does it cost to become a member of MASA? Because all your benefits sound pretty good. As a matter of fact, to me, it sounds too good to be true.
Okay.
But so tell me, how much does this cost? Because it sounds pretty expensive.
So to the audience, we went over the benefits. How much you think a membership like this would cost, or how much are you willing to pay to use a membership like this? Miss Manning? After hearing all the benefits, I just explained 15 wonderful benefits. How much you think a membership like this would cost a month, or how much are you willing to pay to use these benefits?
$80-something.
$80-something. What about you, Miss Rawlins?
I thought it was over 200 at first. I know it's less.
Okay, so we have 80-something, we have 200, over 200.
Tasha, how much did you get cost?
I was this Tasha?
You?
Oh yeah, to touch it.
T-shirt first. I thought it was over 200.
Right.
Okay.
What you want?
Okay, so we have two memberships. We have the International Basic Membership, which is basically regional islands like Trinidad, Barbados, Puerto Rico, Antigua. Now we have an upgraded version, which is the USA Direct, which covers the South Florida, which is Miami. Jamaica is included, and it still covers the regional island. So our most affordable price is
Drumroll.
27 EC monthly. That's the International Basic Single where you could go to regional countries. The family, MASA defines family as two cohabiting adults with or without children, or one adult with a child. So for instance, parents, father, mother, they cannot be on your form, they need their own application form. We advise persons to pay for the appearance. Also, if the child is 18 and not in full college, they need their own application form. If they're 18 and in full college, we cover them up to the age of 23 years old. So the USA single is 54 EC monthly, and the family is 81 EC monthly. Bear in mind, we have a 1-year initiation fee of 162 EC. Civil servants who work for the government, it is totally waived for you guys, so you guys actually get it the most affordable. With businesses, we give you a discount where you pay half the initiation fee. So if you agree to come on board and do payroll deduction with MASA, you pay half the initiation fee.
So you were saying that we just got to pay $27. And so when I have to use the air ambulance now, how much is that going to cost me?
Once you sign up and become a MASA member, once you receive your first payment, it's your choice which membership you choose. You don't have to spend $30,000 US and up, and even the insurance is good. They say they provide air ambulance. You have to pay 20% of the cost of the flight, and they range from $30,000 US and up. So if you do the International Basic Single, if you're not a civil servant, it's only $40.50 EC monthly. That is the 27 plus the $13.50 monthly for the initiation fee, which would give you $40.50 International Basic Single. Family is $67.50 EC monthly. The USA single with the initiation fee is $67.50 EC monthly. Family, $94.50 EC monthly. That is all you have to be paying. Once you're paying your fee, you don't have to ask us how much you owe in the event you need to be medically evacuated.
So you're saying that there's no hidden fees after that? No additional fees?
As I stated, I started last in August, and I was a member before at the Royal Beach Casino, and the price has never changed. Actually, after 1 year, the price goes down.
Anybody else have any questions?
You have the basic. Can you upgrade? You could start with the basic and then upgrade later. Like for instance, if you cannot afford to have the
US
direct, but you want the basic, can you choose the basic and then upgrade later when you can afford it?
That is a very good question, and yes, you can start with the basic and you can always upgrade at a later date.
My question is, do you have to start over when you upgrade or you continue?
In terms of starting over, you mean all over again as a new member?
Yes.
No, the upgrade is just if you're a government worker, single is 54. Sorry, 27 EC for the basic. So if you want to upgrade to the USA now, additional 27 EC. So the 27 plus 27 is 54. So that's the only.
And you continue.
You continue as a member. Yes.
So if you have, like for instance, a year and a half into it, when you upgrade it, you continue.
Yes, sir.
Okay.
So one of the things I just want to make sure that I answer your question as well is whether you've been a member for 2 months, 2 years, 20 years, you will still get the same benefits, right? So when you decide to upgrade your membership, what you're actually saying is, listen, I am more comfortable with the healthcare services available to me in the United States or Jamaica, and I kind of want to choose that option instead. So what you're saying to us, and in your doctors, is if anything happens to me, I would like the option of going to the States. So your membership with us remains the same, it's just know that we're expanding where your options for you. So that's why some people will jump at the USA direct one time, or some people, when they learn about it, because we didn't always have it. What happened is over the years, people started saying, listen, suppose I want to go to the States, well, what does that mean? Yes, well, we are going to take you to the nearest place that is best able to treat you, because like Marla would have said before, in business, time is money. In a medical emergency, time is your life.
Yeah.
The longer it takes for you to get to the place that you need to get the specialized care, as a nurse, you know, the golden hour, platinum minutes, the less likely it is that you're going to respond in a positive manner. So that's why we always focus on taking you to the nearest place best able to treat you. However, some people will say, listen, and like Marla would have said, if you're stable enough to sustain to survive the flight, then that's an option for you.
Or you might have family in Miami versus family in Barbados, and then you wouldn't have to pay like recovery time after the hospital. You might necessarily want to come right back. So if you're not wanting to come back right away, and recuperation takes, rehabilitation may take time, you can go to the family's home and recuperate. Can you come back after doctor give you like a 3 months period after you went back to your sister's home in Miami from the hospital? 3 months have passed and you had to do therapy, and it would be good to stay there too, because you would have had the appointments and you have to follow up, because we don't want master to have to carry you 3 times in a year. So you stay now to get the services offered to help you regain your strength and viability. Can you take us back that time, come back home?
Yes, you would have now used the commercial air transportation. As I stated, once you stay overnight in the medical facility, we pay for your round trip commercial coach airfare, so then now you've recuperated, we would bring you back home on the commercial flight.
Does this recuperation have any time period?
Not necessarily. I mean, that's a very good question. We've never had that question asked before. I'll have to look into that. But based on my knowledge of the information that I have, it's not an issue for us. So whenever you are ready to come back, because remember, you may go up on an air ambulance, and when it's time for you to come back, you have to come back on commercial.
Look at it, because there's 2 things happening here. One, because I've been doing a lot of thinking because of you guys, right? The person might be a citizen, so they don't really have a time period when they really need to come back.
No.
But we know there's a cutoff point for those who are non-citizens, and that's the 6 months period. So when you ask about the 6 months period, and about somebody who is a
citizen,
green card holder or citizen, because they don't have a time now, they can stay. And in staying, they might stay decide they want to hear, but really recuperation, now they're just staying. I don't think that it should be fair that they bring them back at that point, because it's a whole year. But at least have a cutoff point then, because then people need to know
how long to stay.
That's a very good question. Now, I think a year might be, I've never heard of anybody who had to stay for that long period of time. But just to make sure that...
but it depends on the disease condition.
The treatment.
Because some people can't travel back just yet.
Correct.
Because like I have a client, I asked him because I have a client, he flew out and he can't return home. They can't return home because he's not stable to fly. They didn't fly with Massa. I tell her you should have flown with Massa. She didn't fly with Massa, so he's in a situation where he's not stable enough to fly at this point, and it's money because it's a one-way it was. And now she's stuck too. because she can't get out because of him. She's not going to leave him, and then she's not home. So everything at home is at a standstill. I don't tell about myself.
The only challenge is for persons who, if somebody's a green card holder or has a visa, etc., well, that's a whole different story, it's not a big issue. But with at MASA, we also help you through the Foreign Affairs Department and the U.S. State Department. We also help you to get a emergency medical visa waiver. But that emergency medical visa waiver expires 7 days after your treatment or whatever has been completed. So when you've already been released and from the doctors, then you gotta come back home.
Right, so you must have to come back.
Right.
That helps answer that a little bit then.
Right.
So after recuperation, it expires 7 days after.
Correct.
So if your recuperation says 2 months, 7 days after you
Whenever the doctor,
you have to come back.
But then that's based on the country you've gone to, right? So we don't have any control over that.
Right.
But one thing that Mala was saying, with every person on your policy, you, your spouse, and how much of children you have, all are eligible for 2 emergency medical evacuations every year. No,
each of us.
Each of so 2 for you, 2 for your health one, 2 for your children, each of your kids. However, with the commercial flight, in terms of the non-injury, like when you have to go see a doctor overseas, that's unlimited. Like she did mention. So if you go to see the doctor overseas, as long as you've been referred to a doctor there, as long as you're going to spend at least overnight in a medical facility, you could use that benefit.
So that's separate from the flight now.
That's separate.
So this benefit, you're actually going on a commercial. You're already on a flight.
Yes.
Right.
You just say you're going to get first class.
Huh?
You're not going to fly first class, but yeah.
Right. But it's just that, again, it is based on what's available here.
And if we have to go for MRI then, we just want to go.
But no, so, and the reason for that, one of the reasons that Keisha, like you were talking about earlier, why we have to make sure you have a letter of referral, and also to make sure you're spending at least overnight. We don't do the outpatient thing, because you can't just go to the States because you have a ingrown toenail and then you spend the rest of your time shopping. You know what I'm saying? That would be unfair. So we won't do that because a lot of people sometimes, like I said, take this for granted. I've been an EMT for 26 years this year. I've cut people out of cars, picked up people in ambulances and stuff, etc. So I mean, I've seen the diabetics in crisis, people on dialysis, etc. So the things that you take for granted sometimes are the things that sometimes, when they present a major big challenge. But like you were saying, if you had just simply signed up for something that is cheaper than the bottle of water that you were drinking, well, it's probably cost about the same thing as MASA. MASA really works out to be like $1.80 cents a day.
Yeah, 85,
right.
86.
Because it's less.
They sell the bottled water I had for like $5 when we have functions.
Okay, see, so what I'm saying is MASA actually costs less than a bottle of water for that amount of peace of mind. Now, you could have a case of water in your house and maybe, like you say, you don't drink it, but at least you know it's there.
Right.
If you have MASA, who really wants to go in an air ambulance? Who really wants to have an emergency where your child is dying or, you are dying? You don't want that. Nobody really wants that.
Because we are labeled poor, because we have labels, and we don't know which our options. That's a big deal for me. Knowing your options is safer and much more nicer.
And more affordable.
Yeah.
And that's why...
even if it wasn't really affordable, the point is, there are options. Some people, only the rich and famous know their options, and then the poor people get left behind. And now that we know their options, we can make more informed decisions.
Definitely, and that's our thing, because that's why Marla and I have become so close in terms of working, because she's very passionate about. It's not about people see us as initially as insurance.
And her mom is in nursing,
right,
and you're EMT. I think that's what you bring to the table, because you have the other health aspect to it too.
I think that helps me a lot, because, and again, for me, I didn't want to be involved in insurance. Actually, I didn't want to, but when I came and I saw what they did, it was, for me, it was an opportunity for me to be a patient advocate, because it's more than just the caring part about this whole thing. It starts for us right now before you have an incident. So for us, it's about sharing information. Would we likely become a member of MASA? Yes, it's going to be profitable to us. But what we are more passionate about, our mission is very clear. We want to be able to inform and advise every member, the 54,000 people in this federation, so that they can make an informed decision. Whether or not you choose to become a member of MASA, that's on you. But we want to know that we took our time and explained to you the benefits, how we could be beneficial to you and your family. And if you choose and say, well, me want that, then you did that. I wouldn't, because no, we had a situation a few months ago where a little baby had to be flown out. We did the presentation at the workplace for the dad, but I think he was out on sick leave or something that day, and we felt so bad that one situation that for whatever reason he wasn't there and he did not receive that information. He said become a member of MASA, but he did not receive that information at that point in time, and we said to ourselves, we ain't doing enough. We gotta go back to the drawing board, because we were in conversation. She called the HR person, like, where was this guy? What? I mean, we were trying to find out where did we drop the ball. So now what she does when she goes to presentation is, how many people work here? You got 20 people working here. Well, only 15 is here. What happened to the other 5? They're on sick leave, they're on vacation. Well, how do we get in touch with them? Because that situation made us change our whole entire approach. Because we figured we show up.
You asked, and Samson wasn't here, and she was the one who gave you our information. So today she's here. She wasn't here when you came to us, but she's right here now. Okay. So we realized you did ask, and then we didn't get everybody in. People were working.
Yeah.
Right.
Wyatt was working in there too. This other nurse here. So both of them are here today because they weren't here when you came initially.
Yes.
And we would come back to our workplace as many times as we need to be able to get in touch with people, because like for us it is, we don't want to hear anybody cry. We don't, that's not a good feeling for us. Anybody who is sick and at the hospital, we go to visit them, we go to funerals of family members, because we believe in relationship, we believe in people. It's not about profits for us, it's about people. People are always going to be first. The two most important things to me is my team and my clients. And the corporate will tell you that if me and them get in an argument, it's because I want to make sure, and we haven't had any arguments, but because I come pretty strong sometimes, but I want to make sure that any time it's a decision to be made, it's going to be made in the benefit of my client. I live here. I moved here for a reason. I live here, so I am not going to, anything that I say to anybody is what I'm expecting for myself. So if I say to you, this is what the company is going to do, that is because I truly believe that. Because that's what, we don't get any special perks or benefits. We have to pay for our memberships out of our pocket the very same way. It's not part of our plan, our package, so we have to do that. So we want to really make sure that if you know about MASA, just look, you can reach Marla Hobson. Marla, I don't know your number offhand.
You can reach me at 669-7152.
Will I just send people to your office?
Thank you very much for that. And mine is 767-8747. You can call us anytime. I mean, of course, we prefer for you to call us between, reasonable hours. But if you call me, right, but if you call me, I am going to answer my phone, and that's my WhatsApp as well too. And guys, if you have a concern, like Keisha asked us some very hard questions at times and some scary questions, but it's because she wants to know that, listen, that we are doing what we said we're going to do, and that she understands. So I really appreciate that. Another one of the frequently asked questions people ask, and I'm going to just say this for the benefit of those who have been a member for a long time. People ask me the question. One day they said, suppose I never use MASA, what then? And we often say to people, if you do the math, MASA's most expensive plan is $360 per year. It don't take a math to figure out that means that it's actually going to be less than $1 US a day per year, because there's 365 days in a year and it's 360 for the year. When you multiply 360 by 20 years, that's $7,200. My math is correct? Anybody go to that? 360 multiplied by 20 should be $7,000 something. $200, right? The average cost of an air ambulance is going to be about $30,000 US on average. Half of that is going to be $15,000. Half of that is going to be $7,500. So even if you don't know how to do fast math, it's just simple. So over a period of 20 years, you still have not even paid a quarter of what it would cost for an air ambulance. If you had to use an air ambulance once in that 20 years to save your life, your husband's life, your wife's life, or even more important, the life of your child, would it be worth it to you? And I believe the answer to that across the board would be yes, it'd be worth it to you. So we don't wait for you to have to pay into anything, any maturization, etc. You become a member today. As long as we have received your first payment, it could be $27. That activates your membership, and you are eligible to receive.
I didn't know that.
You're eligible to receive all of this. So we don't have any claim forms, any co-payments, any deductibles you have to meet. We don't do partial payments. We have no maximum dollar amount that we're going to pay out. We don't have any health questions, any age limits. Like Marla would have said, the only thing that we do is, look, we even cover pre-existing conditions after 90 days. That's just it.
Yeah, because the client flew out and he was 95. And the doctors didn't really think it was necessary, but the family knew, they loved him. And he's with us 2 more years since flying out. I don't think that he was massive though, but I don't think so. I would have known that. But he flew out and he returned commercially after recuperation. But he was 95, and you would think you're flying out somebody who's 95 who don't live their life. The abusers would say that he don't live, you know. But you're wrong. He's alive 2 more years since that. So then just to show, it doesn't matter the age.
It doesn't matter the age. No, it doesn't matter the age at all.
He was strong enough for surgery twice, and twice he fly out there. Once from here, once from St. Thomas.
Yeah,
and then he came back home.
And that's remarkable, because usually at that age, the symbol they can't survive.
Because it's an individual thing, not an age thing. The age is just a number. Individually, he was a strong man.
And I think,
a strong man.
I think, like you were saying too, in the Caribbean as well, I think a lot of the statistics we get are based on, I don't know, get a lot of blows for this, but it's actually based out of the United States. And that's, in my opinion, one of the most unhealthiest countries in the world because of all the fast food and different things. Down here in the Caribbean, we are not as engrossed in fast food, although we get a little bit like that. But so we tend to have a different demographic here in terms of how we present health-wise. We have women in the Caribbean here who are 50 years old and stuff like that and having children, you know what I'm saying? And they tell you after 35, after 40, you can't have children, but that works for them, it doesn't work for us. So we just kind of a little bit build differently, so to speak. But I just wanted to just again remind everybody that Massa works out to be $27 a month. And again, we did 686 flights last year, and I'm sure those 686 families did not they did not start out thinking that that's how the year was going to be. And look, this year has been an amazing. Nobody thought this year was going to be the way how it is at all. I mean, I have had 3 deaths in my family for this year alone in terms of closeness. Mom, second mother, and grandmother, all within 9 months. And so to hear you talk about some of the things, I'll be like, people take things for granted, Keisha, because I would do anything right now for my mom to be here, for me to take care of my mom. I would do anything. You talk about a lot of what you're saying. You talk about, my mom would ask me if I don't eat out. Like, you don't eat out? I'm like, what do you mean? Like, I was eating home. And it was a practice of mine from the time I moved back to Virgin Gorda. Every meal, like at lunchtime, I come home to eat. Even if I buy food, we come home, we plate it out, and we sit down and eat, because that was very important. You talk about the loneliness. Loneliness does kill people, there's no joke. So when you hear Keisha talking about that, you might think she's passionate and she just overboard, or she might just, be dramatic. She's not. I mean, loneliness does kill people, especially older people. So that little bit of care, and that's why I love care nursing agency, because when I always tell you guys, you put the care into healthcare and home care. It's not just, I was on the phone, I was messaging, when you see me on the phone, I wasn't being rude. I was on the phone literally messaging family members saying, listen, you think it's time for a shower chair for your mom? No, I could show you that T-shirt. You think I think, or maybe a bedside commode for the night, because we take these things for granted. And let me tell you something, people don't realize, especially when you get older, you find you have the hip fracture. I've had 2 of them. My mom had one this year, and my stepmother had one too as well. The fall, and sometimes they don't always present themselves. When you look, by the time you look at the x-ray, you got about 4 or 5 different fractures. That didn't happen one time, that happened over a period of time. So if you could prevent that, that's really amazing. And sometimes a conversation. That's why for us, we don't push sales. What we do, we just have conversations with people. That's literally what we do. We talk to people. Like right now, we want to know how you doing, how you making out through the COVID. I mean, you walk in, how you eating, you know what I'm saying, and how you live. We want to know. I mean, if you could get yourself from Massa, then fine. But caring is a very important thing, and I just want to say, this nursing agency, coming from the US, I'm accustomed to this. I've seen some of this, but this nursing agency to me, and I'm not just saying this. It's next level. This is something I think, in terms of you have a vision that's 10 years in the future. That's right now, and people don't understand that. And I want to tell you that, and all you ladies, I want to tell you, keep doing what you're doing. Keep saying what you're saying. Keep speaking what you're speaking. Sorry?
And shy.
And gentlemen.
Sorry, and gentlemen. Sorry, I forget about that, right? That's the one rule among all of these thorns. You know what I'm saying? But keep doing, Keisha, because people may not understand it now, accept it now, but things are going to happen. So I really want to tell you, especially this I was on the phone also trying to find it on ZIZ or on Facebook to try to send the links out, because I think people need to hear these things more. And I mean, when you realize that you have a whole schedule for the whole year, I mean, in terms of different health things, and that's amazing.
That's organization.
You know, that's vision. That's vision. And when you're talking about, let me just say, being a manager is one thing, Keisha. A manager, anybody who come in and manage a business already established. It takes vision and leadership to create this.
Create it.
And leadership is what it deals with. People, management deals with system. A manager is not always a leader, but a leader can always be a manager. So I definitely applaud to you guys again. Thank you for the opportunity for us to be here, and thank you for always encouraging us as well, because I know you encourage us big time.
Yeah.
And guys, just tell everybody about Care Nursing Agency and about Massa. Okay, remember?
But we're gonna put it on the YouTube channel.
When this is done, they'll ask me what it's for.
Good. And guys, remember,
Right away.
Care Nursing Agency puts the care back into healthcare and into home care. And Massa, most affordable piece of mind you'll ever own. And I think that's a match made in heaven. Perfect number.
Thank you so much.
So thank you.